Well, I think there's enough of us here that we'll go ahead and start and call our meeting to order. My name is Kay Leach, and I'm serving as a chairperson for the board. I'm going to ask that the board members introduce themselves to you. First of all is George Hegeman. George.
George, I'm a longtime board member and retiree from the biology department at IU, a microbiologist, and I'm a member.
Okay. Mark, you're next.
Mark Norrell. I'm a senior lecturer in healthcare management and policy at the O'Neill School of Public Environmental Affairs at Indiana University.
And Steve.
I am Steve Pritchard, longtime board member, retired dentist from Bloomington.
Carol.
Carol Lukian, retired pediatrician, been on the board for a long time.
Bob.
Bob, you're muted.
Okay, Robert Wren, retired obstetrician gynecologist, been on the board 3 or 4 years.
Also with us is our administrator of the Monroe County Health Department, Penny Caudle. Penny.
Penny Caudle, been the administrator since 2008.
And behind her is our health officer, Dr. Tom Sharp.
Yeah, that's it. Yeah. Dr. Sharp, I've been in family practice and the county health officer for many years.
Many years.
Yes.
Thank you, Dr. Sharp. And then also our legal consultant, Margie Rice. Margie.
Good evening. I'm Margie Rice. I'm a county attorney. I've been a municipal lawyer for about 20 years.
Okay, so that's who we are. Also with us, or not with us tonight yet, is Ashley Cranner, and she may be joining us shortly. Next on the agenda is public comment. This is an opportunity for anyone out in the public that would like to bring an issue or a comment to the board. They can do so now. All you have to do is raise your hand at the bottom of the screen. We will limit your conversation to 3 minutes. Technical staff will give you a warning before the 3 minutes is up, but you will be cut off after 3 minutes. But if there's any issue you'd like to bring before the board, please raise your hand at the bottom of the screen. I don't see any hands raised. Does anybody know if there are hands being raised I'm not aware of?
There are no hands raised.
There's Michelle, our technical person. Thank you, Michelle. Ashley is with us right now. Ashley, you want to introduce yourself to the board, to the people on that out in public land?
Yeah, I sure will. Hi, everybody. Ashley Craner. Got my master's in public health from Indiana University, and I've been on the board for about 12 years now. And I currently work in the recorder's office for the county as chief deputy.
Okay, we're glad you were able to get through to us. Okay, next on our agenda, since we have no public comment, is approval of the October 21st meeting minutes. Did everybody get those? Does anybody have any corrections they want to know? I did find a couple. Under administration, if I can find it. About vital records, the first line, it says vital records staff met with the IU Health Baby Unit to discuss the processes all staff. I'm not quite sure what we meant there. I wondered if it was we met with the IU Health Baby Unit to discuss processes with all staff. Okay, and then one other correction I noted was under board comments. It just read funny to me. It says the board asked Ms. Caudle on the progress of the variance. As of right now, they have been advised to inform Ms. Caudle if they would like to come before the board. It sounds like the board's coming before the board. I think we should say The board asked Ms. Cottle on the progress of the septic variance. And then as of right now, the parties have been advised to inform Ms. Cottle if they would like to come before the board. Does that sound okay?
Yep.
Do I hear any motions?
I move we accept the minutes with the corrections that you just mentioned.
Second.
I will second.
Okay, let's do a roll call. Cranner,
I'll abstain since I wasn't there.
okay. Hageman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Tolukian,
Yes.
Wren.
You're
Bob,
muted.
you're muted.
You're muted,
again.
Bob.
Yes.
I could tell what you said, though. I'll also vote yes. So the minutes stand approved with the corrections as we just emphasized. Okay, next on our agenda is public health reports, and that's administration, and that's you, Penny.
It is, as far as I know, Kirk White nor Graham McKean will be able to join tonight. If they were able, they were going to tune in, but Graham did send me a few updates to share with you. Much like the US and Indiana, IU's cases have been increasing lately. They're not as high as their initial bump in mid-September, but they are increasing. The rates are increasing the most at IUPUI, IU South Bend, and IU Kokomo. And if you look at the state, numbers are increasing across the board, but that northern tier of the state is getting hit the hardest right now. So some of that makes sense to expect, but they are seeing increases at IU Bloomington as well. Since November 7th, for all IU Bloomington testing, including symptomatic testing, they've had an overall positivity rate of 1.3%. And usually your symptomatic testing is going to have a higher percentage positivity simply because you've got people who are likely sick. But what they are reporting is a lot of these individuals are having negative COVID tests, but they are seeing more influenza. And our hospital is actually reporting a lot of influenza right now as well. So kind of those two things we're seeing that in several different places. IU did host a mass clinic on November 7th at Assembly Hall for IU student, staff, faculty. They did about 700 booster shots, and they did about 300 influenza immunizations. They are hosting this week, started yesterday through Saturday. There is a vaccine and testing site, and Indiana University was kind enough to, we requested that mobile unit. They were kind enough to give us a location. It is at the Smith Research Center parking lot off 10th and the bypass. And that mobile unit is there from noon to 8, Wednesday, Thursday, Friday, and Saturday. They're doing testing and they're doing vaccinations for all ages. I will tell you that yesterday there was a bit of a glitch. IU had to kind of pitch in and do some of those 5 to 11-year-olds, but I haven't heard anything going, any hurdles today. So I think that got all worked out just fine. So we are thankful for them to host that. Due to the holiday next week, only symptomatic testing will be available on Monday and Tuesday. No COVID check testing will be done, and regular testing will resume on November 29th for IU. And then within the health department, we've talked about this. I think we have several vacancies currently and some coming up. We've got people moving, taking internships, and we're very happy for all of those positive life things that people are incurring. But we are facing some challenges filling those positions with the right people for the jobs, but we are on it and hope to fill those positions very soon. The commissioners did approve our county's syringe service program extension for another 2 years. They approved that, yes, this is Thursday. They approved it yesterday. And along with that, they also approved the extension of the contract that we have with Indiana Recovery Alliance for the operations of the syringe service program. So we're very grateful for that, and that we're not having the hurdles that some of the other counties are having in regards to syringe service programs. In terms of vaccine, demand is certainly super high. We're seeing lots of demand for 5 to 11-year-olds getting vaccinated. We're thrilled about that. Plus, on top of that, we've got people wanting to get their booster shots. So we're struggling to keep up, but we are doing our best. Tonight, you will notice that our public health nurses and some of our other staff are not here tonight with you to report because they are at Richland Bean Blossom doing the first of our 2 super shot clinics for 5 to 11-year-olds. So we have the one this evening, and then we have one on Saturday, which will be at Bloomington High School South in the cafeteria. These 2 clinics are open to any 5 to 11-year-old. They're not school specific, but then our nurses will be working with the individual schools to offer vaccine, as we have been doing. They just finished up their flu shot clinics, and then they'll be ramping back up and doing COVID vaccine with them. We still have Miller Drive clinic is open most days of the week. Saturday is our big vaccine day there. And I do have to note that typically on Saturdays, they've been trying to take some walk-ins for those 5 to 11-year-olds. This Saturday, they will not be able to take any walk-ins. And so that just came up today. So just want to share that for anybody that may need to know that typically Saturdays you can walk in and they will try to accommodate you if they have vaccine available, but this Saturday they will not be able to do that. I mentioned the mobile unit is here. We are also working with IU Health on some radio ads, and those will start next week. We're actually kind of trying to build a little bit of a vaccine campaign using some of our vaccination money, and IU Health marketing team is helping us with that. So we're thrilled about that. So we'll have some flyers and window clings to put around in businesses and places reminding people to get vaccinated. We've got a big banner. So at the super shot clinics, kids can take their picture and share that as kind of a social media thing to do. And then we're gonna have some pop-up banners as well that can be placed at various vaccine sites when we have them. On the testing front, the Gravity site out on Cook property, it did move, but it didn't move very far. Moved to the front side, or I guess the east side of that property. It is really where the old Cook or old GE plant was. So you enter right off Curry Pike and Jonathan. It looks a little funky because there's one lane in and out, but once you get in, it's coned off and will take you right up to the table and the door to the building where you will get service. It is still handled as a drive-through, but the staff have access to the building so they can stay out of the weather and elements except when they're helping somebody. So if you pull up and you don't see someone standing there, just give them a minute. They will come out and they will take care of you. They're still open Tuesday through Saturday, 8 to 4. Right now, they are seeing anywhere from 80 to 100 tests a day, and they're equipped really to do twice that many. So just kind of give you that. They do have more capacity. And as I mentioned, the mobile unit that's at IU is doing vaccine and testing this week as well. Kathy from Population Health and
Can I ask
Outreach.
a question real quickly?
Sure.
For the Gravity side, it's still not taking appointments, it's just,
Just walk in,
okay, all right, thank you.
which makes it really easy. It's pretty easy. The paperwork's pretty easy. So yeah, just walk right up. Well, drive right up, I guess.
Drive right up.
Drive right up. I think they will take you if you walk, but I would drive. Yeah, so Kathy wanted me to share that our department is participating in a public health workforce interest needs survey. This is a national survey that's being done with government public health agencies. at the state and the local level. So the purpose of the survey is to inform future public health workforce development initiatives. And we should get those results once they are done. And that will help us as we look at planning for our workforce and training. So we're looking forward to that and glad to be a participant. And then Dr. Talukian may want to talk more about this, but Kathy and Linnea are working with Dr. Talukian to present a town hall on December 1st from 6 to 7, where parents can get their questions answered regarding COVID vaccine for children, 5 to 11. Dr. Talukian, do you want to add anything to that at this time?
Actually, we're really pleased because Doctors Laughlin, Moore, and Simmons are all going to participate in this as well. I'm just going to give a short, talk at the beginning. Then we're having people submit questions ahead of time. Hopefully we'll have time for other ones too. And hopefully we'll be able to answer parents' questions. What I hear from parents is that right now it's virtually impossible to call the pediatrics office because everybody's like, trying to call like 3 or 4 hour waits to get through. And so we're hoping we can provide some answers to some of these parents who have questions and are on the fence and help them make the decision to get the vaccine for their children.
Can you repeat the date on that and location?
Sure, it will. Oh, go ahead.
Yeah, it's a Zoom meeting.
It's a Zoom. And what was
Zoom
the date?
December 1st at, what time is it, 6?
6.
Yeah.
Okay, thank you
And,
very much.
yeah.
Are we publicizing that, which I'm assume we are, in the papers and so forth?
We will be. We have a flyer, and I may be able to pull it up here in just a second and screen share it. That will, as soon as it's finalized, we're waiting on a couple reviews. As soon as that's finalized, we'll have a flyer that will go out. So we'll also make sure that you get that. We'll put it on Facebook and send it to the schools and have them help us get that out as well.
Okay, cool. Very cool.
That's great, Carol. I'm glad you're working with that.
I think it's a good, hopefully we can get some parent interest in it. Yeah, hopefully people will sign up for it and ask their questions. Apparently a fair number of people that have donated questions already. So submitted, that's what I was looking for, submitted questions already. And so it should be interesting.
I think putting it on Facebook might be a good idea, or that little message, however you do that, would be a great idea too, because I see comments every now and then where people have questions.
Yeah, we will put it on there. We'll put it on our webpage as well, and the commissioners, and we'll send it out to everybody that we know, including the chamber, and let them share that. And that's it.
Okay. Anybody have any questions for Penny? Moving right along. Under old continuing business regulation review, we wanted to have a discussion about our regulation, see if we want to make any changes or whatever. We could stay as we are. Right now, Penny, our vaccination rate right now, when we last talked to you, it was like 61%, correct?
Correct. It did drop, and it dropped because we added a new group. So we added about 10,000 more people. And so we are at, ironically, we are at 57.5% fully vaccinated, and 57.4% have had their first dose. So if you've been watching at all, that first dose number percentage has been what is growing at this time.
Okay.
And I have a few things I can share with you if you want regarding some of the numbers and metrics.
Please do.
Okay. So some of this I'll go through really quickly because we've already talked about it, and I just wanted to share. We do have lots of testing options. Indianapolis Motor Speedway is also open and through Saturday as well. Vaccination availability, I touched on this a moment ago too. We have the Miller Drive Public Health Clinic. We have our Super Shot clinics. That starts tonight. The mobile clinic is here. And for a full list of your options, you can visit ourshot.in.gov. Some of the pharmacies are slow to come into the 5 to 11-year-olds. Some of them are still waiting on vaccine to arrive. Some have vaccine, but they haven't opened up appointments yet. We're trying to stay on top of that and share those updates with the schools so that they can share that with their parents. So that's how we are trying to keep them informed. The other thing that I would say is for those who have means and resources, there are some of the surrounding counties that do not have the same demand that we have, and they have openings in their counties for vaccination. So if you've got the means to go to a nearby county and you can find that available at a time that suits you, I would encourage parents to do that. Linnea, one of our people that handles our complaint line, is kind of checking on numbers every week and information. She is calling those pharmacies to kind of see what's going on and what vaccine they have available and what's happening. So that is where this information came from. And again, we're hoping that by the end of December, our vaccination numbers will certainly, fully vaccinated will be well over 60%. Maybe I shouldn't say well over, but I hope that. And then to our county metrics. So that's the piece that everybody wants to look at. So this map shows you where we were last week and where we are this week. And you can see that the blue counties, and this is just the 2-county metric, seems to be jumping around a lot. But you can also see that there are more orange and more red counties this week. This slide depicts the 2 different maps. So one is this week, it's all by color. The first map over here shows you by cases per 100,000. So you can see that there are a lot of counties that are in red because of a high level of cases per 100,000. We are still in orange in that particular category, but the look is not good. And the second map on the right is the positivity rate. So our positivity rate is less than 5% currently on a weekly metric. And so we are blue in that particular one. So that blue and the orange give us our red, or our yellow, our yellow advisory. So this is what our regulation is built around, right? It is that our cases per 100,000 would drop below 50. And right now they are at 123, which is higher than they were last week. But our positivity rate would remain, under 5%, so that we would move to a blue advisory here, and our cases would be less than 50 per 100,000. So that's where our current regulation is, and that is where we are as we look at it. So some things that are changing. So cases and testing. Right now, when we met last, we were on a downward trend. So the number of cases daily were dropping. They've been rising. So right now, our daily average is right around 31. And the number of tests being done is in that 700 to 800 range every day. It's really pretty stable. There's a little bit of a dip in that, but not a real big jump. When you look at the positivity cases, this is on 10/20. Back when you met, you can see where we were and that the numbers were kind of coming down. But the one thing that I want to point out that I think is very significant is that our deaths have increased greatly. So this is November 18th, and already in November, we've had about 15 deaths reported this month. And some of those people have been very sick for a while. Seems like people are in the hospital longer. This, if you look on the dashboard, it tells you the age ranges of people who have died. And if you remember in the beginning, it was 60 and over, but we are now seeing deaths in younger people in our county. There have been deaths in the state at every age range. And then this just kind of outlines, you can see that we're at 123 cases per 100,000 this week. If I look right now at our numbers, we will probably be a little bit higher than that next week. And you can see where we've been for the past 4 weeks. So as was, I think, reported earlier, according to the New York Times, cases in Monroe County have increased 27% from 2 weeks with 31 average daily cases. The state has increased 96% from 2 weeks ago. And we're seeing those similar types of increases nationally and globally as well. So those are things that have everybody concerned as we come inside for the winter months. So the big question that I will leave with you is, what do you want to do with your regulation? Do you want to continue the current regulation, wait for us to reach that 50 less than, it should be less than 50 cases per 100,000 in a blue advisory, which would mean you don't need to make any changes to it at all. You're going to stay the course. Do you want to change something? Do you want to add an end date back in? You know, we thought we might be close to getting to that goal and kind of left it there. If you wanted to put a date back in, you could. If you wanted to put an end date and just have an end date, you could do that. And if you wanted to change something else, you could do that as well.
Penny, do we currently have any stats on how many people of the people that have died or that are currently cases are unvaccinated people? I mean, it's always a curiosity. And I can't remember if that information is on the website. I thought it was at one time.
Yes, it is on the dashboard. And
I think that might be something to include each time that you give a report about the stats, is how many of the people are unvaccinated. Because
almost all of them.
Yes, and I would just like to remind the people that are unvaccinated that if they're not happy with the mask mandate, we know what has to happen for this regulation to go away. And if it just can, if the unvaccinated continue to make up the vast majority of the cases, well, the responsibility for that is theirs. I mean, I don't know how else to. I mean, I know we're going to be talking about this, but it's very frustrating. On one hand, they want the mask mandate gone, but on the other hand, they're not willing to do the thing that it requires to get it gone. So I don't know. I mean, I can't get people to do what they're supposed to do. So I mean, we can't. So.
People have so many strange thoughts about it. Someone told me today that since we have a mask mandate, they don't need to get vaccinated. I mean, it's just random, bizarre thinking. It's just, I don't understand it.
Well, and then it seems like every meeting it comes up that IU has an event where they're inside like basketball and they're not wearing a mask. Then why can't Bloomington not have a mask? That seems to be the same thing we hear each time in some way. And IU says their vaccination rate's 93.2%, I think is what Kirk told us last time we met. And I sure would be glad to remove the mask mandate if 92.3% of our community was vaccinated.
Yeah, speaking about the basketball game.
Yes, Carol.
Well, I talked to a few people who were there last night, and basically, they do check to make sure you have a mask when you go in. I don't know whether they have masks available for people who don't have them. I don't know that.
They
But
do.
people take them off once they get into the court area. And there were lots of people, you can see it on TV, lots of people who didn't have masks on inside there. And that just seems like it's not okay. I mean, you don't know the vaccination status with people who are going into the game. I mean, I suppose they could check that, which probably wouldn't be a terrible idea. They should, they're not making announcements during the game saying, you need to be wearing your mask. They didn't do anything like that during the game, apparently. This is secondhand knowledge. So if anybody was there, correct me.
Dr. Sharp said they did, but.
They did?
But,
Okay.
maybe not enough.
They make announcements during the game. So I've been to every basketball game so far. So,
Okay.
and the women's games, men's and women's, and they make announcements. The ushers that walk up and down the aisle carry a little sign that says, "Thank you for remembering to wear your mask." I mean, it's mass disobedience. So it's just people get it. They may put it on when they get there, but then during the course of the game, they take it off. I wear a mask, and so does my wife, Penny. We wear a mask the whole game. And I know a
question.
Yeah.
Do they say that masks are required on campus and put your mask on? Or do they just say, please wear your mask?
I think I'm not sure. I can't remember what they say.
Indoors, yes.
Say again, George?
Indoors, yes.
But do they say that during the game is the question? Are they saying masks are required? You need to put your mask
Right.
on?
I mean, that's a disconnect in my mind because, I know that there's a mandate of wearing masks indoors on campus. So that's the crux of the question is it a mandate or not? And if it's a mandate, then why isn't it enforced?
I think there are too many people. There are just so many people that just don't wear them that it's just impossible to police that.
And so many are not students and are not familiar with the
That's
mandate.
correct. Yeah. And I even sit in the staff section. I mean, we always have because my wife used to teach there, but there's still plenty of people in my section that don't wear masks. I know that. So
At this point, IU's not here to address it with us because I think that's an issue. It's a really, really bad PR issue. And I mean, it's obviously not what should be happening. And you kind of wonder about, whether the athletic department is somehow gifted to not have to do this. And it's just, it just feels really wrong to me.
Right. And beyond just the feeling, I think that you could probably contact Trace and say whether this is, contributing to positivity. So that would be something for Kirk too, is, are you looking at this from a contact tracing standpoint and what's the evidence?
Yeah, I would say, I know Graham and I have talked about this because they have such a high level of compliance, like on campus, in their classrooms, those kinds of things, that to even see the students at the games unmasked seems like, there's something going on. In terms of contact tracing would be with their faculty or staff who come up positive, which those are very small numbers. Others outside individuals, IU's not going to be contact tracing. So it's about whether or not they participate in that, whether or not they say I was at the game and I was unmasked and I was around all these people, or whether they withhold that. So that cooperation can even play a part. But absolutely, if we start having reports that people were positive and went to the game, then that's a piece of information that we can use and to deal with that as well. But it is definitely a challenge.
It's clear to me that it's in violation of our ordinance, and it's clear to me that they're not able to enforce it very well. And so I think the ball's in IU's court. What are they going to do to enforce it better? Because they clearly aren't.
And it's a slippery slope, and it's a messaging problem too,
I agree. So it's unfortunate they're not here to respond to that. I asked earlier if they were coming, but I guess that didn't happen today. for whatever reason. But I just feel like they need to say, I need a response from them. I need to know what they're going to do about it because it's not okay.
When you have an IU ticket, do you have to indicate your proof of vaccination? Is that a mandate?
No.
They don't.
No, and we can't.
Went to
Legally, we can't right now.
Brown County Music Center last week, and we
It's
had
voluntary.
we had to show our vaccination record, and went in the stadium of like 2,000 people watching this guy, and about 10% had masks. The rest took their masks off. 2,000 people in the audience, kind of like a basketball game, but they required that you have the vaccination evidence before you're admitted into the music center, Brown County.
Yeah.
I'm surprised the basketball.
Yeah, but that might have been a requirement of the group that was playing, because
Right.
the contracts of the people who play can have those sorts of things in their contract, even though the venue can't.
Well, the venue could, so the business could, but government agencies, so our state agencies, we are not, there's a new Indiana law that prohibits us from doing that. So we could encourage every business to ask for, proof of vaccination to be served or come in, but we can't mandate that.
I said earlier, my daughter just left for the Purdue game, the tournament, and it's, I think, in Connecticut. Anyway, before they can go into the game, they have to show their vaccination card. Now, that's in that state.
Yeah, it would be nice.
It would
It would
be.
help us a lot, wouldn't it?
It sure would help us a lot. Well,
If
back
we
to our
could get somebody
regulation.
to just sit and zoom in on certain areas and start issuing fines. They just start issuing tickets and fines to people that aren't doing their masks. I don't know how we would do that, but I mean, it's kind of like the scooter deal, they're not allowed on sidewalks, but they're on the sidewalks all the time. And that was like the one recommendation because it's hard to police and enforce. But, having, random people or enforcers, writing tickets, hanging around downtown for people that are breaking the rules, but I mean, again, it's impossible. But wouldn't that be ideal? We just start passing out tickets.
Well, unfortunately, we're here to protect, not punish, but protect. And unfortunately, I don't know how we protect without a mandate.
I don't either.
Well,
Unfortunately, the mandate
What's our
is-
pleasure with the regulation?
I think we should just keep it the way it is. And people I talk to in the community are overwhelmingly in support of keeping the mask mandate. There's a few people who are not happy. Obviously, they're the ones that chat. But I ask all my friends, whenever I interact with them, they all say they want to keep the mandate.
yeah, let's keep in mind that, the majority of the people are still in favor of vaccination, and the most of them are supportive of mitigation measures. So yes, unfortunately, it's a very, very vocal, not a small minority, but minority nevertheless. And so I feel, yes, that like Carol does, that we should stick with our mandate. We can't control everything, obviously, a big event like this, but we can certainly bring it up and see if they can at least try to do more.
Yeah, I'd really like to see IU take some accountability for this.
I can reach out to them.
I oppose any kind of termination idea, any idea that everything's going to be great after a certain date. I think we've got a chronic disease here.
Well, and
And an upward trajectory right now. We're seeing an upward trajectory and we're headed into holidays.
well, I've been reading some articles about a fifth surge, especially with the flu season coming up, and it's scary. I think our rates are even going to get higher.
Well, and people are gathering at the malls and the shopping centers and the restaurants. And, I think, yeah, I'm in agreement with the board.
Do I
That's
hear a
all we can
motion?
do.
I move that we continue our regulation as written.
I'll
I-
second.
Second that.
If you want discussion, I'll say that we don't need a motion or a vote.
Oh,
Right?
yeah, because it just stands.
Mhm.
Good point.
I think you're right, Mark. Okay.
Hey, I did find one slide that Dr. Pritchard was asking about. If you want me to share the screen.
Please.
Okay, can you see it?
Yes.
Okay, so that's what we saw this week. So you can see it's come down some, but that bottom line is the vaccinated people in the hospital. So it's up and down, the blue line, but that is your unvaccinated people.
Why was there such a huge spike right there? What was going on? Where it just,
Well, that's
I
August,
can't see.
September.
That was the surge.
Yeah.
okay. Yeah, I can't see the dates or anything very well. Wow.
That's
Penny,
from about the middle of
That's-
August to about the middle of September. That's where that big surge was.
That's
Penny,
right.
would you mind sharing your slides in an email to us? I mean, at least to me, I very much would like to have
Sure.
that data. Thank you.
Yep, I can do that.
Appreciate you very much.
Okay. Moving on. New business. And our new
Actually,
business.
I have another question for Penny.
Okay.
Is that, this has to do with the kids, is that data with the number of cases or hospitalization, or anything, is that, is there any age-related data out there in terms of number of cases?
In
In
terms of the
Indiana.
hospital, I haven't seen any.
Or just positivity rates and like over time like that? It's a nice graph because I think it's going up in kids too. So that would be,
It definitely is.
that would be a good graphic to be able to show during our town hall
Sure.
if that exists.
I'll get Linnea on that. She's good at
Okay.
finding that. If we don't, we may have it back in another slide, or she may be able to pull it off the dashboard.
Okay, great. Thank you.
Anything else? Dr. Sharp, is there anything you'd like to add under the how we're dealing with the regulation?
Well, my addition is, we have the same problem we had last June.
I'm sorry, I can't hear you.
You need to come over
Oh,
here.
okay. We have the same problem we had 14, 15 months ago. We can mandate all we want. People they do as they please. We don't have anybody can really police this. The police can't do it. Our few people can't do it. I agree with leaving the mandate in place just because, but I don't have any great feeling of hope that it's going to change a whole lot of behaviors. We just have to keep plugging away. You can't save people from themselves sometimes. That's like saying don't smoke. Don't drive fast, obey the rules, be reasonable. And there are people who aren't going to do it. And we can't count on owners to do this to solve our problem for us. The only way you can change people's behaviors through their pocketbooks sometimes, and that's not all the time. But and this thing that the city's doing, I really do like that. Your insurance is going to cost you an extra $600 a year. It costs everybody $600 more a year, but you get a rebate if you've been vaccinated. Of course, there's a lot of screaming and yelling about that, but that's what shapes behavior. There's got to be a money thing, and we don't want to get started having vigilante people shaming and screaming and yelling and fighting. And, you know, I mean, that is really counterproductive. Even though that's what these people deserve that don't get vaccinated. I mean, they deserve it, but and we have to remember that they're costing everybody else a whole lot of money. You know, insurance rates, all the time and energy put in on this problem by the people that like Penny, who does an incredible amount of work on this. But there are lots and lots of people trying to help us survive, and they're just this group of people that just they know more than everybody else. And I've heard people say, "Well, I'm really healthy. I'm healthy, and if I get it, my chance is 0.000, you know, if they give me some ridiculous number of dying." And it's low, but on the other hand, you're going to have a lot of it's going to be painful learning your lesson if you guess wrong. And the numbers coming from the state show that it's huge, the number of people that are unvaccinated going into the emergency room, the hospital, the ICU, and dying compared to the unvaccinated. But that's not compelling enough for some people. They're smarter than everybody else. I heard recently that there are two groups that are the worst, and one of them is a little surprised. Well, one of them is African Americans, and that's just who knows what that is, and the other is PhDs. You know, I was appalled at that number, but I understand it. You know, they read a few things and get online, and I don't know. It's crazy. I don't understand people's behavior. This is so obvious to you and me. It's not. But people think they're immune. They think they'll last forever, and they can't get it. And I've just had a couple friends that have gotten it. One of them got it from her son, who wasn't old enough to get vaccinated, and I don't know where he was not in the county, by the way. It's a tough problem. Probably the best thing we did was over this past year and whatever half was getting the people to go around to the businesses and just kind of show up with what they have on their shirts.
Security pro.
Security,
They're still doing it.
yeah. And so, you know, that I know that owners live in fear of being inspected and getting in trouble and fined and all that stuff, but it's crazy. People can't make other people behave. I really appreciate places that have a mask mandate in their store. You know, that's somewhat controllable, and that's so important for the people that work there, like Kroger's. I mean, my gosh, if everybody went in there unmasked, just think of the number of exposures those people would have in the course of every day. About IU, Carol, I totally agree. In my section, gosh, it might be 10% that wear masks the whole time. They just don't wear masks. And the really scary part, I'd rather be in the student section. They're 92%. But all these people that come up from all over the place, all over Indiana, we don't know anything about them, and it'd be impossible to figure out who they are and what stage of the illness they're in. Because there's a program where you have, and you can have symptoms and pass it around and not be aware of it. It's a very tough problem. I think what you're doing is the right thing. I don't have any Pollyanna hope that it's going to make a great big difference, but I don't really think much of anything is going to make it. Some people can only learn by experience. You can't intellectualize anything with them. They're going to do what their prejudices say. So how's that for a whole bunch of gray?
You know, it's interesting too, Dr. Sharp, is that, you know, the people that do get it, and even though they've spent, you know, a couple weeks in the hospital, they come out saying they survived it, didn't kill them, and now they have a natural immune. That's the one I see a lot or hear or read about in terms of like personal testimonies. Is that, well, it didn't kill me and I'm fine.
Yeah, they don't know about the long-term consequences. It's way
That's
worse
right.
for the disease than it is for the shot.
That's right.
And
Yeah.
they still may be carriers.
Sure. Well,
Yeah, that's actually one of the most common misconceptions is that natural immunity is better than the
Yeah.
vaccine.
yeah,
It's very-
I've heard that both ways, but the last I heard, the shot was maybe as many as 5 times as good as
Yeah,
natural.
well, the reality is with natural illness, if you get it, depending what your viral load is, has a lot to do with how ill you get. So people who get it don't feel very bad, probably don't have the biggest viral load, which means they probably don't have the best reaction. But if you look at data on immunity after natural disease, it's clear that it's all over the place. People are immune, some people aren't. And the only thing you can say is that for maybe 90 days after you've been vaccinated, after you've had the natural disease, you may be immune, but it may be as long as 6 months, but that's not even clear. But it's very clear from data that's available for vaccines that you have a certain level of immunity, which is protective.
Sure.
And now from data we're getting over time, we know that we probably need to be boosted again after 6 months because that's about how long it lasts. But at least we know that the reaction to the vaccine is consistent and predictable,
Pretty
which is
much
not true of natural disease.
true. Yeah.
Sorry, I get carried away sometimes. I'm sorry.
No, I agree with you. That's a valid point.
And it's also true that our mask mandate does help because if you look at our data compared to surrounding counties, we're clearly doing better. If you go inside, which I try to avoid like a plague, going inside anywhere outside of Bloomington, people aren't wearing masks.
Right.
But they do. But the vast majority of people are wearing masks. Not everybody, but surely a lot more people here are wearing masks than they are anywhere else. Even if not everybody complies,
I'm encouraged by the number of people I see in stores and so forth that have masks on. I think more are wearing them when I'm out shopping and so forth than those who aren't.
I agree. Oh, cheers.
Well, anything else on the regulation? Okay. Penny, are you still there?
I am.
I seem to have lost you on my screen for some reason.
Yeah, Dr. Sharp's on the screen.
Okay.
I'm here.
That's the reason.
She is to my immediate right, and I'm usually, when you see her, I'm on her immediate left and behind her a little bit.
Okay. Well, moving on down on our agenda. Next, I'm glad you're there, Dr. Sharp. The next is our new business is appointment. And as you know, the way appointments are done has been changed with the new laws and so forth. Margie, are you there? Do you want to address that?
I am here. What is it that you want me to address?
Just address that now we have to go through the commissioners and so forth.
Oh,
We don't do
absolutely.
things-
Yes, and so, for the appointment. So the General Assembly has had a lot of oversight. I actually just attended a CLE today, and there was a lot of talk about the new laws that were passed. And I attended a CLE from the State Department of Health where Monroe County was mentioned because of our enforcement measures. We are the only county with a mask mandate. The attorney for the State Department of Health mentioned that we had done a good job with our appeal hearing and our enforcement of that and following the new state law. We also, as you know, have litigation pending because of the appeal hearing. But the defense of all of those new state laws is that, and it makes sense if you think about our democracy, is that we now have an elected body, the legislative body of the county, that has to approve actions of this appointed board. And so the idea is that there is an elected body that can be held accountable for the actions that are taken in Monroe County. And generally, I think all of the actions that you guys have taken and that the commissioners have wholeheartedly supported have been overwhelmingly supported by our community. I mean, we have a few exceptions, obviously. We wouldn't have litigation if we didn't. But the majority, as Carol said, the majority of people are are very grateful that we are helping them to keep their employees and their families safe. So we continue to monitor, what's going on at the state, and I'm in contact with the attorney for the State Department of Health and others. And so, we'll just keep following the procedures, and hopefully I don't like to talk about litigation much in public, but I did want to tell you that, we have filed an answer, and we are waiting for a judge to be appointed. So there's a move for a special judge. And so we are waiting for a judge to be appointed, and we will be filing a motion for summary judgment.
Okay, so as I understand, in the past, the 30-something plus years that Dr. Sharp's been our health officers, that was a vote of the board. That
And
now,
and now
the board
the
makes a
commissioners.
recommendation to the county commissioners, and they do the appointment.
Yeah, his appointment will not be, again, just because they want this legislative body to be held accountable. His appointment will not be final until it's approved by the commissioners. And there's a procedure in there that basically you can have 2 attempts to have a health board officer approved. And if you can't get it done in 2 attempts, then you've got to pick somebody else. I don't think that's going to be our concern here, but you can see that it's fairly controversial in some counties. And in a lot of counties, I think the reason the General Assembly put that in there is they did not think that the Board of Health and the elected commissioners or legislative body would agree. We don't have that problem here in Monroe County. So we can be grateful for that.
And Dr. Sharp, we want to thank you too. 30 plus years, actually almost 40 or maybe 40, that you've served in this capacity. We all owe you a debt of gratitude for what you've done for our community.
I'll admit it's been 46 years, but thank you so much for your vote of confidence, for your kind.
So
He's a good role model. He's wearing his mask.
So Penny, do you need a count from us, a motion
Yes.
for us? Okay.
Yes,
Do I?
we need to move to reappoint for another term. Terms are 4 years. That would be the motion.
Okay. And Dr. Sharp, are you willing to serve in that capacity to
Certainly.
continue?
Absolutely.
Okay. Do I hear a motion? Steve, you're muted.
Wouldn't want you to miss this. After long and serious deliberation, considering Dr. Sharp's long service as our county medical officer, I would like to make a motion to reappoint him as our county health officer.
I would like to second that.
Okay, we have a motion and a second. Let's do a roll count. Cranner,
Best vote, yes.
Hegeman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Wren,
Yes.
and I also vote yes. So we'll send that recommendation to the commissioners, Dr. Sharp.
Okay, and let me just say, I really appreciate all the stuff you guys do. I know it's a lot of thankless time and energy, and I really appreciate your interest in local health, Monroe County health, and the COVID thing. And I think you guys are doing a really good job.
Thank you. On behalf of all of us, I'm sure. Any board member comments?
Yes, Kate.
Okay.
If I might, I'd like to highlight for the board and also for media that may be on right now, something that Penny shared with us, which I thought was worthy of highlighting, and that is we have now a Governor's Public Health Commission that is active, and they are studying things like the structure of our public health system in Indiana, and they are studying the funding and financing of public health. And they are looking for public input And I will type into the chat box, there you go, the link to the online survey where individuals here can provide public input into issues like public health funding, public health workforce, public health governance, that's us, public health infrastructure, emergency preparedness, data and information technology integration, and other issues. Now, this is, they're seeking input, but understand that this is not a venue to be talking about whether there should be a mask mandate or not. This is not that kind of thing. This is a big, broad study of the system, right? And so this is the chance for people to provide their thoughts on what we're going to look like in the state of Indiana for public health infrastructure 10 years from now. So I provide that link to you, and thanks.
Thanks, Mark.
Yeah, I really appreciate that. Penny and I were talking about it, and it's nice to have public health be a priority for the governor in the state of Indiana, where our health outcomes and our health indexes are always, sometimes we just can't go any lower. The Indianapolis Star has done a great reporting piece on maternal mortality lately. And these are the kinds of things that we need more reporting on, we need more input on, and we need more action on. So I'm really excited about this too, Mark, and I really appreciate you sharing that. I'll be right on it, and I'm going to be sharing it with other people too. So yeah, it's nice for the state of Indiana. Let's do this.
Anything else? I'll piggyback on that and remind everyone out there that it is National No Smoking Day. And that if you would like to quit smoking, reach out to the health department, because we have some resources out there that we can help you with and would be glad to do so. Okay, let's talk about our next meeting. Penny, do you have any suggestions on a meeting date? If we go a month, we're getting into, we could do like the 15th, which is a Wednesday or a Thursday. Thursday seems to be working well. That's the 16th. Or the next is the 23rd, which that's awfully close to Christmas. So I'm looking at the 16th. How does that sound?
Do we need to go a month? Is that
Good.
good for a month? Okay, yeah, that works for me.
Works for me.
At 5?
At 5, does 5 o'clock work better than 4?
But
I like 4, but
I wouldn't mind earlier.
I can do either.
Okay, well, I probably, if I have to do it at 4, I probably will be doing it from my phone in the car, which is.
That's right. No, well, that's right. I remember now.
Does 4:30 work for you, Steve?
Uh,
Will 4:30 work for you?
Well, I just have an appointment in Indianapolis at 1 o'clock. So hopefully that'll be done and I'll be home by 4 o'clock, but. We'll see.
I could do 4:30 or 5, but not 4.
Okay.
How about 4:30?
4:30.
Let's say 4:30 on this December 16th. Can you, does that work for you, Penny?
Yes.
Does that work for you, Margie?
It sure does.
Fantastic. We have a date, December 16th at 4:30. I'll see everybody then and have a wonderful Thanksgiving.
You too.
Thanks, everybody.
You too. Thank you.
For all
See
we
you, everybody. See ya.
Thank you.
Good
Good
night.
night.
Good night.